I applied for my psychiatric assessment diagnosis back in order to get student loan disability allowance. You needed to send off proof of the diagnosis. Now, what I didn't expect back was every single letter that I've ever received regarding my mental health, and this is assessments that I've never seen before, going back from 2015 to 2020. I was actually in both Liverpool and Manchester care with mental health, and I've got no idea if this is both or just Liverpool. Now I'm going to go through this and I'm kind of going to explain where they went wrong. So I have no disrespect for the NHS, doctors, nurses, psychiatrists, etc. But as a whole, the mental health service in the UK is absolutely despicable. My story is just one of many, and I hope that by providing some actual proof that you can see how it goes wrong. This is just my experience, obviously, but I know I am certainly not alone with this. So I have borderline personality disorder, anxiety, depression and high levels of stress. And I believe borderline personality disorder is how do I explain this? So for me, my personal belief is I've always had the genetic markers of borderline personality disorder, and through trauma I had as a young child, as a teen, it's kind of like exploded that gene and has made that part of my brain come to life. I don't know the actual scientific terms for it, but that's my understanding, is how I see it. It's the simplest way to explain it. So I'm going to go through these papers basically. They are meant to be private and confidential, so obviously I'm not going to give any like names or anything like that, but it's my story and it's my story to tell. But I'm gonna read you what it says on here, not all of it because it is thick. I'm gonna read you some of the things and I'm gonna give my interpretation of it. So what the nurses wrote down versus what I recall saying, what I felt at the time, etc. Now, just before I actually start, I just want to say that if any of my immediate family are watching, I'm gonna respectfully ask that you don't. There's some things that I haven't opened up about that I probably will talk about in this, and that is simply because I don't want to upset you, especially my mum and dad. I love you very much, but there's some things that I have still not figured out how to tell you, and I don't want you to see it secondhand on a computer screen. So if you are watching this up to now, Mum, you can feel free to ring me and I will have some vodka and then I will tell you. As I said, this is just my story, and although I did eventually get a diagnosis and I did eventually get some kind of tablets that work mediocre, I believe that the mental health service in the UK is absolutely appalling, and I just want to give some evidence on that. The first, honestly I don't even know where to start with this. So this is the first one, and this is 9th of February 2015. So I was 16. I was in a sixth form college. This was a CAMS assessment in hospital. This was after I had self-harmed at home, and it was pretty bad, and I went up to my mum and was like, I think you need to see this. and we went to the crisis team at A&E that we'd recently found out about. And so yeah, they patched up the scar, well, the cuts. They don't wash them, they just put plaster on basically. Sometimes they don't even put a bandage on. And so yeah, 3:30 in the morning this was seen. They've basically given a description of what I was talking about how I had depression and suicidal thoughts. Now they gave me like a questionnaire and they said, what do you think is wrong with you? And I put down on that questionnaire borderline personality disorder, depressed, suicidal and bulimic. And in this they put bulimia as well. No mention of borderline personality disorder, even though I'd done my own research and I knew for a fact I had it. It says about my poor sleep, it says about my restricting my diet and things the year before. For some strange reason, I can't remember this, it says my concentration reports only being able to concentrate on casualty TV programme, but finds difficult to concentrate in college. Although it says under hallucinations and delusions, reports hearing my own voice saying kill myself, worthless and fat. There's no psychotic phenomenon identified or reported. Risk to self. I began self-harming in May, and it says that my mum had found tissues and things, but she never said this to me. And that my suicidal thoughts were getting worse, although there are no other self-harm forms identified, and I've never required medical attention. No risk to others. And the main thing that is really upset me with this, risk from others, Vicky was subjected to bullying in primary school and her local area, and said she eventually moved house. Now that says that I was bullied in my local area. I was sexually abused by neighbours' kids, and I said that in multiple reports because it was on my mind at the time, because I had my boyfriend and we were sleeping together for the first time, and that was quite triggering for me, bringing back all these memories of abuse that I'd had. I didn't know it was abuse back then, because even when I said it to these people, they put it down as bullying. It took me years later for someone to turn around and say that was abuse. So yeah, I told this nurse, this mental health practitioner, that I had been sexually assaulted and it was on my mind and I'd been really triggered by it, and she put down that I was bullied in my local area and eventually moved house. Summary: Vicky is a bright and warm 17-year-old female. She feels emotionally worn out and feels her friends are unboundaried with her problems, and this is not reciprocated in attention. She expresses guilt and regret at her treatment of younger brother and others. This manifests in self-harm, feeling worthless, and has impacted upon her appetite, and deliberately lost a significant amount of weight at the end of 2012. The family has also experienced bereavement and paternal nan, and this still feels raw between Vicky and mum. She reports being unhappy in college and with her chosen university, but is under a lot of stress with exams in 3 months. Despite Vicky's identified close friends, she is also going on a trip to Paris after exams and identified a profession behind the lens in films. I discussed with both Mum and Vicky the services available, and they have agreed referral to improving access to psychological therapies is much quicker. The form requests a professional referral. So, recommendations and risk management plan: discharge home to care of mum, risk management discussed and agreed, advised to provide So the recommendation and risk plan is discharge home, risk management discussed and agreed, advice to provide receipts when she goes out. That's to stop me drinking, I think. Provide her whereabouts at all times. Advice to self-rate her mood daily. Advice to present to A&E if there's significant risk of harm. Follow-up appointment with CAMS. Complete the improving access, that is psychological teams, and I will be then discharged from the response team. So the follow-up, there was then a follow-up 3 days later. Follow-up appointment carried out by response practitioner, no further concerns raised, has occasional self-harm thoughts and no current suicidal plans. Victoria has returned to college and referral, and I'm discharged from CAMS response team. So this is the 12th of March 2015. A different hospital. I'd taken myself to the crisis team. What has led to this assessment? Patient has attended due to feelings of unwanted and self-harm. She's attended with her friend. She says that she has been feeling like harming herself. She has a history of cutting herself, and the last cut herself approximately 3 or 4 days ago. She was due to speak with the access team today, but she was not at home when they called her and they did not have her mobile phone number. Victoria presented with her friend who wanted to stay in the assessment with her. She has poor eye contact and her speech is low but normal rate and content. She says that she's come here tonight because she's not feeling too good and is upset about everything. She says that she's having thoughts to harm herself. She said that she's been deliberately harming herself for a very long time. She says that on Saturday she cut herself with a knife and showed me several superficial cuts on her left forearm. She says that the cutting started approximately 2 years ago briefly and then she started again in May or June. She says that she did consider burning herself 2 weeks ago, but in the end could not do it. Her tutor at college arranged counselling for her when another tutor witnessed her self-harm scars. This counselling started today. She's been referred to see CAMS, but they felt she was too old for their services and referred her back to her GP last month. When she saw her GP this week, he made an urgent referral to Access Team. She believes that she deserves to harm herself because she's upset people in the past. Right. Attempts on life, no. Thoughts of suicide, yes. Other self-harm, yes. Impulsive acts, no. High distress levels, no. Substance misuse, yes. It says substance misuse including, oh right, yeah. Socially isolated, no. Psychiatric diagnosis, no. Yeah, so this was mental state examination. Victoria feels slowed down at present, whilst on the other hand feels physically needs to keep moving and busy. She feels unstable to concentrate at times and her memory may also be affected. Objectively, there is no any evidence of formal thought disorder. There is no thought broadcasting, withdrawal, blocking or insertion. There is no evidence of disclosure of intrusive or paranoid thoughts. Mood. She describes her mood as generally low and having been worse since the death of her grandmother in March last year. Objectively, she is tearful, has flattened affect and feelings of dissociation. She describes at times acting as though she's really happy, but inside she does not feel happiness she is portraying. She describes tasting metal sometime and says that she hears a female voice but she's unable to make out what it's saying. She says that it's been hearing it since she was a child and does not disturb her as it's always been present. Victoria says that she's been thinking about killing herself for the past 2 or 3 weeks. She was thinking of swallowing stuff, then running away and taking tablets. She's not put plans into action. She feels able to keep herself safe. She says that she has forced herself to not carry out these plans. She says she was going to swallow sleeping tablets or paracetamol or swallow silica gel, and she's not chosen to do this. Here we go. She says that when she was around 5 years of age, she was forced to have sex with a boy slightly younger than her under the instruction of older girls where she lived. She says this happened 3 or 4 times, but has only recently disclosed this to a few of her close friends. She has not told her parents. She says she should not feel distressed by this in any way. She was bullied in both primary school and secondary school, more so in the latter. So he put it in. And then that's summary. There is certainly some level of dissociation at play for this young lady. She has a number of conflicting issues around her being sexually abused and how she sees her own sexual identity. There are issues around self-image, self-worth and self-esteem. She has used deliberate self-harm as a negative coping strategy for the past 2 years. She does not appear to receive positive affirmation from her parents or peers, and this further feeds into her own feelings about herself. The loss of her grandmother, with whom she was fairly close, has created some unresolved grief issues. She would benefit from short-term antidepressant medication in order to resume her mood at a level at which her own more positive coping mechanism. I discussed medication and advised to prescribe fluoxetine. The first instance we monitored in... Oh, can't read that. I've advised patients that self-refer to YPAS, which she said she was going to do, but for some reason this hasn't happened. I provided a telephone number for her to follow up. Discharged home. Okay, so this is following an overdose. My first overdose. Now this is the 23rd of March 2015. I took the overdose to end my life. That was the first time I'd ever deliberately attempted suicide, and I remember the moment clear as day. I remember the moment it came into my head to do that, and it was a intention to end my life, but at the same time I took myself to the hospital. So I don't know, I can't tell you why I did that, because one part of my brain wanted to die, but the other part of my brain knew that the day had to carry on as normal. So this is the assessment following that. Now this says it was at 3 AM in the morning, 3 AM when I took the overdose, at about 12 PM the day before. So that's way over 12 hours me waiting to see a mental health specialist. Before that I was literally passed from pillar to post. They did blood tests, they did different kind of tests, they shoved me in a children's ward, they found me a bed. I hadn't eaten, so they gave me a sandwich, and I didn't eat the sandwich. My mum was there, my best friend at the time was there, and it was just like surreal. Like they kind of didn't know what to do with me because there was nothing physically wrong with me. And because although I'd taken the overdose, it had gone out my system because I didn't take enough. So by the time the mental health team got to me, those feelings had kind of gone. I felt like I was there for no reason. The nurses were clear to show that they felt I was there for no reason. It was very much, I need to go home. So okay, Vicky was referred to CAMS following a reported intentional overdose of 12 times paracetamol tablets taken due to her reported low mood. Vicky denied suicidal intent related to this, stating she just wanted to hurt herself. I don't remember saying that, but I know I wanted to die that day, so I'm not sure why I said that. Vicky reports long-standing issues related to low mood, suicidal ideation, and deliberate self-harm. Vicky reports an incident in which her best friend became upset with her as the trigger for this episode of deliberate self-harm. She described the overdose as impulsive, and she took the tablets within about 5 minutes of first thinking about it. Vicky's a 17-year-old young lady who at the time of assessment was dressed in casual clothes and was well kempt. Her conversation and interaction were cooperative and appropriate, with Vicky being able to give good accounts of events, both current and historical. He could not identify any changes to his thought process or any untoward thought content. He could not identify any changes to his thought process. I wonder if this is a copy and paste and they've not changed the pronouns. Or that sentence was for someone else. Vicky was orientated to time and place and engaged well throughout. Her speech was spontaneous, coherent and relevant, although quiet at times. Vicky maintained good eye contact throughout, answering all questions. There's no evidence of cognitive impairment or thought disorder. She described current issues related to body dysmorphia and ongoing purging. Using universal... Vicky reports that she smokes only when drinking and drinks socially with friends up to 4 times a week. She does not see this as an issue, but in all she probably drinks more than the recommended weekly allowance. And nothing's changed there, hun. Vicky's a 17-year-old young lady who presented with low mood, blank and suicidal ideation. Objectively, this appears to manifest from feeling of worthlessness has impacted upon Vicky's self-perception, with her engaging in purging and restricted diet. Following her latest assessment on the 4th, she was referred to IAPT for further intervention. However, given that this is her 3rd presentation, I am referring her to CAMS with the intention of transfer to adult mental health services. I'm also referring her to Knowsley Eating Disorder Services for further assessment. Vicky was unable to give any reassurance as to her personal safety if discharged home, stating she wasn't sure she would harm herself again. Given this, I've requested to remain on the ward. Now, I never went to an eating disorder service, so that's actually quite interesting for me to see that apparently I was actually referred. Because for me at that time, that was never ever spoken of again with regards to my eating. Even though I told that lady, that I'd been purging and not eating and restricting, etc., and nothing was ever done. So I'm actually really surprised to see that. Okay, so this is my discharge notes. Discharged home, referred to eating disorder clinic and CAMS. So this is then the 27th of March, so I've messed up all these pages. So I was discharged on the 25th of the 3rd, 15. So I stayed in, I think, 3 nights. And then on the 26th of March, I was taken to hospital via ambulance after taking an overdose. There's nothing else about that. It just says that treatment was given and I was fine and I was told to go home. That's literally what that says. Investigation was undertaken, cut below my bloods and that. Treatment was given, observation, head injuries. The plan on leaving the department was to admit the patient to a hospital bed. A full clinical summary will follow on discharge. I never got a bed, so I went home. This is 27th of May 2015. Dear Victoria, I'm glad I was able to speak to you today, not only to wish you a happy birthday, but to hear that things had improved for you and you felt much better. As we discussed in our telephone conversation, this letter is a discharge letter from the well-clothed child and adolescent CAMS. And you are now 18 and therefore able to access adult services. 12th of June 2019. So between 2015 and 2018 I was in Manchester, and obviously Merseycare have neglected that, which is really disappointing because I was diagnosed in Manchester. Manchester's services were so much better. I was under the Salford care team, and I could not fault them. They were absolutely fantastic. So this is a change from medication. Diagnosis: emerging EUPD on account of her age being under 25, concurrent anxiety, medication escitalopram, which she wants to switch to sertraline. Didn't know I wanted to. I will discuss with MDT whether discharge is appropriate given that she is out of our current catchment area. Switch to sertraline. I will write to you separately about. I saw Miss Carter in the clinic today, 19th of June 2019. She was last seen on the 1st of September 2017. She DNA'd with me on the 13th of June 2018 and the 8th of August 2018, but says this letter went to the wrong address. She also DNA'd the majority of her psychotherapy sessions and the discharge from the service. She says this because she could not go. She has a new job and it clashed with the sessions. She's... Sorry, this was talking about a guy I was dating, oh my god. Oh, feels this relationship is going well. It didn't go well. Her libido is very high at the moment. She puts this down to being with her new partner. She last used cocaine in March and she barely uses cannabis. She does drink alcohol with the recommended national guidelines, having 2 glasses of wine or 3 or 4 vodkas a night. We discussed ways she could cut this down. She will consider this. Oh, this is different. Victoria's a Caucasian white woman who appears to be in her early 20s. She was casually and appropriately dressed but reasonably kempt. She was slightly overweight and a little informal in her behaviour. I'm not being funny, but that's the horriblest thing to ever read in my life. Like, I've actually got chills. What the hell? Like, you know when you know when you know you're not in great shape, but then you see it on a form. You see it on a form as a observation. Oh my god. What a stupid thing to be asked about, but can you tell I've never seen this before. She was slightly overweight and a little informal in her behaviour. What does that mean? Eye contact was appropriate, speech was normal and rate, tone and volume fully. She described her mood as okay. I feel stupid. I feel stupid for being upset like that, but seeing it as an observation from a stranger. Seeing, like, I know how horrible is that? And I was probably smaller then than I am now. Literally, the tablets made me put on so much weight. Like, for strangers to thirst for, like, to be, what? Because I went from eating one meal a day to eating 2 meals a day, and I had the tablets that were making me hungry. And I know I should probably be smaller, but seeing it like that is just just not great. Oh, sorry. This is why I'm doing this, because the things they write in these reports okay, so this is just really interesting because it's missing all my ones from Manchester, and I was in A&E a lot in Manchester. And it's actually weird not to see all them. So ongoing stress, so this is my GP in August 2019. Suicide. So this was last summer when I was going through a lot of shit with work, and I had my uni dissertation, and I'd just split up with my fiance 5 years, and the guy I was seeing suddenly stopped wanting to see me, and everything went to shit in the space of a week. So this is a referral from my GP to the crisis team. Now this was about 2 weeks last summer, and it was bad, and that's probably half of what this is here. Okay, so history: ongoing stress related to work, split up with long-term partner, has to pay mortgage and bills by herself, so struggling with finances, under investigation in work, and they're not taking her mental health issues into consideration. So it's about wanting to end her life, says he clear intent but hasn't worked out how to do it yet. Took overdose 7 times over the last 5 years, has thought about drinking bleach. I thought about doing a lot more than that, but yeah. Examination: a bit tearful, well kept, good eye contact and good rapport. I have contacted psychiatrists to see if they can RV her today, but they inform me they have discharged Victoria, and if has active suicidal thoughts she will need to go to A&E to see crisis team. Dad present, says will accompany her to A&E. Examination: obviously a bit anxious, fidgety, reasonable eye contact and rapport, no evidence of psychosis. So the problem is, oh, this is interesting. So 8th of August 2018, borderline personality disorder. Oh no, okay, so 24th of December 2014, delivered with self-harm. 26th of March 2015, delivered drug overdose. 8th of August 2016, borderline personality disorder diagnosis. 20th of June 2019, anxiety states. And then 23rd of August, suicidal ideation. I just think it's interesting that when I obviously asked for my GP notes, that they've not included the Manchester ones, because this is important for me to get my money. It's fucking hard, and then I'm really struggling to work at the moment because everything is just hard, and I need the notes, and they've decided, because they don't talk to each other, these two different boroughs. I am being affected by it. Anyway, this is the hospital. Your patient, the hospital to the GP. Your patient was treated in our walk-in major department and has attended one time of the previous 12 months. After an overdose. That's all fancy words I can't really understand. 26th of August 2019, Miss Victoria Carter was referred to the Crisis Resolution Home Treatment Team by A&E and was initially assessed reviewed on the 28th of August 2019. The initial impression was working plan was to provide Victoria support regarding her suicidal thoughts, provide her with information regarding distraction techniques, provide her advice and information about other services that will be beneficial to Victoria when she's struggling with her mental health. And go to the Personality Disorder Hub. The intervention was to provide visits to explore Victoria's suicidal thoughts and to help her manage those better. And referred her to the hub. Discharge plan. Personality disorder referral completed and emailed to managers. Victoria will be discharged today, discharged back to GP. Victoria is planning to contact the Life Rooms and Whisk today. Victoria agreed to attend the Liverpool Light. If she's struggling, need to speak to someone. Victoria agreed to utilise the mental health support from her university when required. Some education given around distraction techniques. So what actually happened was they came to my house once, and I'm a great actor, as in I have had to deal with lying about my mental state for so long now, for 23 years of my life, that I'm great at it. And they came to my house and they saw that I was a university student with my master's degree. They saw that I had a mortgage on my own. They saw that the house was reasonably tidy, and the exact thing she said to me was, "You're happy and you're smiling and I think you can do this, so I'm going to discharge you." Because I was smiling, I wasn't worth help, is what I took from that. I wanted to die. I'd taken overdose, self-harming every day. I was on my own, so I felt like I had no reason, no one to come and find my body, was what I said to myself. And it was okay because I was happy and I was smiling, so I was discharged from that. And it's interesting that she didn't put that in there. So this is outpatient clinic, 20th of November 2019. I reviewed Vicky on the 20th of November 2019. Vicky attended the appointment and Momo attended throughout the review. Vicky has been known to have EUPD for a long time. She stated that she started on escitalopram and fluoxetine. She stated that escitalopram worked for a while, but then it stopped working for her. She hasn't had any previous admissions of mental health hospitals yet. She stated that she's always been suicidal and has had more than 7 episodes of overdoses. The last was in August 2019. She also has many episodes of self-harm. Vicky stated that has been swinging lately. She stated that her appetite has not been good as previous, and her main concern, she starts to binge on sweets, especially chocolate. Her sleep pattern wasn't as good, but she's currently back at work and able to go to bed at approximately 12 o'clock. Has good sleep until about 7 o'clock. Now this is where it gets interesting. It's the things they write about what you've said. Vicky has had a couple of boyfriends in the past. The last one left her when she had this breakdown, which she now thinks is better that he left her because he wasn't supportive. She's currently living on her own with Kin, dog, which is why she wanted to be here in order to feed her dog. Now, I have a cat called Freddie. I've only ever had one boyfriend. So what the hell? I've only ever officially had one boyfriend and one girlfriend. I've dated a few boys, but I've never been in multiple relationships. So Vicky was casually dressed and well kempt. She maintained good eye contact all through the interview and rapport was established. Speech was coherent to the point of average amount of volume and amplitude. Her mood was subjectively and thematically. I reviewed Vicky on the 12th of March 2020 at Moss House. She attended the appointment alone. Since stopping sertraline and starting the combination of venlafaxine and quetiapine, Vicky feels much better. She feels her mood has improved, and although she has occasional suicidal thoughts and self-harm, she feels she's equipped much better. So, after reading all that, it wasn't as bad as I thought it would be, if I'm absolutely honest. I feel like a lot of the good stuff is missing. Because I attended numerous hospitals in Manchester, and the GPs and the nurses had a lot of conflicting things to say, to one point where a trainee mental health nurse, band 7, said that in his professional opinion, no one under the age of 25 could have borderline personality disorder, no matter what my psychiatrist said. So it would have been good to see those kind of things. But I just think it's interesting what they say, because every single one of them said that I was well kempt, I had good rapport, I had easy conversation skills. Now, I am from a middle class family. I have never gone a day without food on the table, as in, personally I didn't want to eat it, but it was always there. I know that I am in a very, very privileged position, and not once have I ever wanted to deny that position. So me being well kempt is, my mum probably would never let me go out with holes in my jumper. I've gone weeks and weeks and weeks without showering, but I'm one of those people where my hair goes from greasy to looking normal. And if I knew I was going out of the house, I probably would have showered. So I don't know, I just think it's interesting that you can see those ones, the dates are so interesting, where they're like, oh, she's fine, discharge, she's fine, discharge, she's fine, discharge, oh, she's back with an overdose, oh, she's fine, discharge. I just think they judge you based on, appearance, they judge you based on attitude rather than what you're actually saying. And as I said, it said that I was referred to an eating disorder clinic that I never ever got an appointment for. Might have helped if I did. I'm trying to think of what to say, but if I'm honest, I think it kind of speaks for itself. The fact that I've never been in a stable GP. I've never been in a stable hospital, or whatever you want to call it, service. I've never been in a stable service. I've been passed from pillar to post to pillar to post. The same as in Manchester. I went to a CBT counsellor who said she could do nothing for me. I went to a CAT counsellor who said that she didn't think it was going to work. I went to a free service, a charity service, who did an initial assessment with me and said that it was not going to work. I did a thing for Manchester University where I got paid £20 to answer their questions, and even they stopped seeing me because I didn't fit, because I guess that is such a part of borderline personality disorder, that you're so able to create this other world. You know, the brain and the voice, they don't connect, they don't say what you mean. God, I just think that it's just really interesting to read what other people say about you, what other people assume about you, because a lot of that is assumptions, a lot of that is their opinion rather than fact. Was if I'd have written that, I'd have been, I am going to kill myself. Was they've put, she is smiling, she has good rapport, she says she wants to kill herself, but there's no immediate risk. And then 2 days later, I was back in there. So I just wanted to highlight how, if you've gone to any kind of assessment, you're completely entitled to ask your GP for these notes, and I would encourage you to do that and look through them and see what shit they've been chatting. When I was in a different service in Manchester, I know they said that I cut my neck, which I've never done. What can I say? Yeah, I'm gonna edit this now and hopefully it makes sense.